welcome to Ask the Panel Season 2.
But we need to wake up and realize, study more about we ancient philosophy.
I think we really have to stick together as a society. I think we come across very negative to each other.
If we don't, one, support each other, or we don't put our money back into each other, how do we expect to have people that are going to be somewhere in 5-10 years?
Hello and welcome to a brand new season of Ask the Panel. I'm Manu Myers, and in this season we're talking about being Black in Britain. And in this episode we're looking at how Black people can and should navigate health, as well as how to look after ourselves better and receive better healthcare. So joining me today we have some amazing guests. Ladies, please introduce yourself.
Hi, my name's Claudine Thornhill and I'm the owner of Claudine J. Thornhill Nutrition, and I'm a nutritional therapist and health coach.
Thank you, Claudine.
Okay.
Hi, my name's Alicine. I'm here to talk about my experience with the NHS caring for my son.
Hi, I'm Fisayo FYO and I'm an actor and presenter, and I'm just here to share some of my opinions.
Oh, thank you, Fisayo. So guys, we've got a lot to go through this episode, so let's get straight into it. So far, what's your observation and experience surrounding Black health in the Black community?
For me personally, as a nutritional therapist and health coach, a lot of my clients are Black people, Black women, and I've done some contract work with the NHS around type 2 diabetes prevention. And my experience is that anecdotally, when clients come to me, they generally are kind of exhausted of going down the traditional routes. Maybe they feel they haven't been listened to or heard, or they're just not getting the right solutions, or the approach to dealing with their health issue just hasn't met their needs fully. So they've come to me to just, I guess, maybe just be a bit more proactive around taking care of their health and managing their health. Also, I find Black people in particular, want to work with somebody who looks like them and who maybe understand the experiences they've been going through and how they live and the types of food that they eat and things like that. So that's what I can say for the clients that I work with.
Brilliant. And your end goal is to help them to achieve positive outcomes?
Definitely positive outcomes, whether it is managing or better dealing with a health issue that they're dealing with, managing the symptoms, overcoming the symptoms, whatever it is that can make them live more fully. That's my ultimate aim, is to help people to, what I say is I help people to eat well, feel well, so they can live fully. And I just want people to actually live a full life and achieve their potential by just feeling well within themselves.
Amazing. Oh, thank you, Claudine. And Alicine?
So I'm talking from the perspective of almost like the patient, as I cared for my son, who is 17 now, who was born with sickle cell anemia. And then later on went on to have a bone marrow transplant. So I feel we had two different experiences within the NHS or healthcare system. And one of the things that I would like people to realise is how much power they have within their decision making. So for my son, at first it was quite daunting having your consultations and whatnot, but over time, I realised that there were just ways we could navigate the system. For example, sometimes your consultations are months apart, so prepare questions in advance and things like that to make it so you're not left with more questions. You're not leaving with more questions. So I just wanted to kind of put that across, that there are ways you can take back your control and take back your power, although the system seems so big and you can feel quite small. But yeah, just to reinforce that you are able to do that.
And if you could change your experience, if you could change anything about your experience, what would you change?
I think probably the only thing I would change is maybe speaking to my consultant sooner. What I mean by that is, if I had any kind of deeper thoughts and feelings, I will email his PA or contact him outside of or before a consultation. So he knows my thoughts and we can discuss them fully at the actual appointment.
So exercising the power, I guess a lot of people feel they don't have within the healthcare system when it comes to dealing with healthcare issues
yes.
of some sorts.
Yes.
And yourself, Fisayo?
Just to kind of reiterate that I just feel like there should be more support for Black people in regards to healthcare, and whether that's mental health, whether that's emotional, or whether it's physical. I feel like there needs to be more of a strong support system in the UK, especially for Black people who have a lot of high-rising illnesses and issues. And I just feel like there needs to be either more representation of us, where we're able to, like, for example, we've got representation as a nutritionist amongst us here, and I feel like as Black people, we are more kind of interlinked with people who we identify with, and the more of us, the better. And it kind of breaks that kind of how can I explain it? It just breaks that mold where Black people are more receptive to healthcare because we see that representation, and I think the more the better, basically. So yeah.
Yeah, thank you, Hisaya. And what would you say your main concerns are when it comes to the Black community?
I would say more or less mental health. I feel like it's becoming an open discussion, especially worldwide. People are starting to be more receptive to mental health becoming a group discussion, but I feel like there still needs to be that stigma needs to break in terms of the perception we have with mental health. Like, you seeking help is a crazy idea, especially amongst us Black people. And I feel like the more we're having these conversations, the more people are more open to seeing a therapist or a counsellor. I feel like it's going to give more of an altitude for Black people to be more receptive to taking on more support mentally.
And seeking help, I guess,
seeking
as
help,
well.
exactly. Yeah.
Indeed. And what would you say, Alicine? What would you say your main concerns are when it comes to health in the Black community?
Well, certainly in my case, I would say more emphasis on the nutrition side of things.
Okay.
Because for me, as I said, my son had sickle cell anemia. So although we were told, take this medication and whatnot, which was obviously used for whatever purpose it was given to him, at home, one of the things was me sort of changing his diet and realizing what can help him to strengthen. It is a blood disease, so what would help enrich his blood or strengthen his blood, strengthen his muscles. So with sickle cell, you get something called sickle cell crises. And I felt that they reduced just from him having better diet or being more aware of what he was eating.
Okay.
And for example, he didn't really grow up eating sweets, but just finding alternatives. And I felt that did help him. And it reduced his crises. And he had just a better quality of life.
And what services or support networks supported you throughout?
Yeah, so that's another thing. So sometimes there's support services out there that people, other parents didn't know were even available. And sometimes that comes from your medical team. Obviously they're so busy focusing on his condition, they don't really make you aware of support or community support or sometimes even financial support that's out there. So in that regard, I think there is support out there, but it's not highlighted enough. So yeah, it's not highlighted enough. And I would urge other parents to seek out what support is out there and take it, because whatever makes your life easier, you're already going through enough, but as I said, it should be more highlighted. You're seeing your consultant and that team quite often. So I think within that area, that's where they should actually direct you towards support services. Whereas really you kind of find it more through your local authority or just through, government websites. But it could be more highlighted if it was where you actually attend.
So adopt a duty of providing the information, advice and guidance to families like yourself.
Links
to raise
directly
awareness
to the
of
system. Directly to the health system. Yeah, I think that would help other parents and carers and patients. Yeah.
Amazing. Hopefully we can see some change in the near future.
Yeah, definitely. Hopefully.
And Claudine, what would you say are your main concerns within the Black health community?
I think it's kind of multi-layered. I think there's things that contribute to different things. I would say that just judging by what's happened in this year alone, I would say stress, trauma, dealing with emotional well-being, I think is a major thing. I would say things around stress management, emotional healing, trauma. I think those are quite prevalent. But in addition to that, we know the kind of disparities that we have in health outcomes when it comes to things like type 2 diabetes, cardiovascular disease, maternal deaths and maternal health care, those kind of figures as well. So, and trauma and stress and things can play into those kinds of diseases as well, because they create inflammation in the body, less able to sleep, less able to repair, restore your body and things like that. So I think it's multi-layered, but those are some of the concerns that I have, I would say.
And I'm going to throw it right back at you and ask you, how would you advise us to take better care of ourselves? How would you advise us?
Again, it depends on what issue someone is dealing with. I would say, based on the clients that I work with, I would say a common theme or a common factor is stress. No matter what health issue the person's dealing with, stress is always somewhere in there. So I do some work around helping people to manage stress and strategies that they can put in place to manage stress. So I would say that's something to deal with, because I think, it can have knock-on effects and on other areas you're dealing with. And even if you have got a health issue, if you're stressed, you're not able to make best choices around food, best choices around seeking resources and seeking help and things like that. You could isolate yourself. So I think that's something quite important.
Agreed. And how would you guys say, how would you advise someone from the Black community to take better care of themselves, and what advice would you give a Black individual to take better care of themselves?
Well, going off what Claudia just said in terms of stress, and then it leads to, not eating right. It can then lead to sort of mental health conditions and it can, I think anyone suffering from any sort of long-term condition, I think automatically the mental health side of things should be, monitored. And again, in my case, my son had his transplant, so he was cured of sickle cell, thank God. But I did notice later on down the line, he was dealing with other sorts of problems. And in terms of the actual, directly him being Black within the NHS, within the National Health Service, one incident what happened with him was during the transplant, he had lots of complications. So he had his body was trying to sort of repel the transplanted bone marrow, and that kind of threw up a skin condition, quite a chronic skin condition. And when I first noticed it was started off as a sort of a light rash, but when I pointed it out to the dermatology team, they couldn't see it. And again, he was obviously Black, they were not, and they kept on trying to convince me that's his normal skin texture, even though I know his skin wasn't like that. And to be honest, that's something that with early intervention, it could have maybe prevented what came after, which was pretty drastic. His skin started to almost eat itself up. It's called graft versus host disease. But it was just that early intervention, I think, would have prevented it getting somewhere, because there was certain medication they could have given him early to suppress the immune system and stop that happening. And I felt that was directly because him being of colour and them not understanding his skin texture and whatnot. Yeah, so that was definitely a direct, I think, situation.
I'd say more awareness needs to be raised within those healthcare environments.
Awareness.
Absolutely.
Yeah, awareness.
And just officer.
Just from a personal perspective, I think what you put in your mind just kind of alternates how you function in life. I feel like if your mind is clean, how you what you extract out of that is what's going to come out. So I feel like as well, just in general, whether we're Black, white, pink, I think like it's all about your mental health in terms of keeping it clean, keeping it healthy, and that is what's kind of going to make you function in life. I feel like you wouldn't keep a dirty car. You wouldn't go inside of a dirty car, would you? Because you're going to be contaminated with whatever is inside that car. So I honestly believe how you keep your mind is what's going to kind of alternate what's going to come out. So yeah.
Agreed. And with so much going on in our community, how do we maintain a good mental health, considering our current circumstances and what's going on? How do we maintain a good mental health?
I think more importantly, I think you've got to do what's right for you. You've got to find an altitude, what makes you happy, what little things can you be doing day to day where you can be able to kind of seek some sort of I would say some sense of joy, or something that you do. Maybe it's a ritual, maybe you pray, whether you meditate, something that kind of makes your day a little bit easier, which where you can find that that common ground where you can be like, okay, cool, this is what works for me. Because it works for me, it may not necessarily work for Alice may not work for Alice. So I think you need to kind of find out what works for you, what brings joy, happiness, what things, like for example, I like to go to the gym, I like to work out, I like to meditate, I like to pray. So I think it's just finding what works for you and where you can seek that sense of joy, whether it's happiness, like makes you fulfilled, where you can alternate in this difficult life we're all trying to navigate it.
Yeah, exactly.
Yeah.
Thank you.
Definitely, it all starts in the mind or ends in the mind, you know. So keeping yourself active, I think, is important. You know, having the body move starts to loosen those, you know, endorphins. I found sometimes it's easier said than done. So trying to maybe create habits that can get us to start moving, even if it's something small, even if you start doing 5 minutes, you know, a day, and then increase it. So I think that helps us to deal with our mental health, and I think that exercise is important.
Like what you were saying in terms of like tapping into the joy, I think that's one thing as adults we can miss out on. I think joy and fun, like sometimes we're so focused on work and doing and delivering and executing that, you know, sometimes we don't take enough time out for fun and creativity and that kind of thing. So again, sometimes that's what I kind of talk to my clients about. What did you do when you were little? What kind of creative things were you doing when you were little? You know, what can you do now? But also I'd say sometimes at different points, you know, what works for someone might not work for another person, but also what worked for you yesterday might not work for you today because you have a different need. So today it might be prayer and meditation. Tomorrow it might be you need to exercise. The next day it might be you need to watch a comedy. Depending on what is missing, it might be, you know, you could fill the gap in different ways. So yeah, I think it's kind of listening to what you need right now in that moment.
Perfect. And being a health practitioner, how would you, what approach would you use to, I guess, help someone that has health issues but are reluctant to seek the help?
Two things come to mind. I guess one thing is that, like for example, sometimes I work with clients who maybe are reluctant to go and see their doctor or reluctant to go and see their GP because of a bad experience they have had, or they feel they're not going to be listened to. And I say that, you know, what I do is complementary to the conventional medicine approach. So I say it's better to be informed than not. So even if you maybe decide for your own reasons not to take medication or not to follow the advice, I think it's better to go and have tests or get the x-ray or get the scan so that you're informed, and then you can make a decision around what you want to do. So I think that's number one. And then number two, sometimes what I say to people as well when I initially talk to them, I say, you know, if in 6 months' time, if you had the ideal health and ideal, you know, life, what would that look like? You know, so you to overcome your health issue, or you were to improve it, what would that look like, and what would you be doing, and you know, what would you be doing with your family? And sometimes that can help people to think, actually, if I dealt with this, then maybe I could just, you know, spend more time with my kids or excel in my business or something like that. So
yeah, amazing stuff. And how would you advise on Black people defending and protecting themselves against racial biases?
That's a very good question. I think it kind of depends what angle you're coming from. Me per se, I try to not look at race. Sometimes it's hard because I feel like as soon as you start looking at race, you start coming from a different angle and a different perspective. But I really try to look at a broader sense and think about, okay, cool, what can I do in this moment that is going to validate me and what's going to work for me? You know, as Black people we already have labels put on us, you know, and I always try to look from a perspective where, okay, cool, let me not make it about race. Let me take something from this situation or this moment where I can benefit from it. So that's why I always try to look at, I know it's more of like it's what I'm saying is quite general and quite generalized, but I always try to look at it from an angle where, okay, what can I do in this precise moment that's going to benefit me, instead of me trying to think about, okay, it's about race right now, it's race bias, right? Okay, and then I'm coming from like a complete different angle. Okay. So I always try to look from a perspective that is more optimistic, if I'm being honest, but I try to challenge that in a way that I feel like, okay, what can I take from this experience in a way that's going to benefit me for the better. So, yeah.
Thank you. Have you guys got any other different ways of protecting or defending yourselves against racial biases? Because let's be honest, society is full of it. Do you know what I mean?
Yeah. Sometimes what I've noticed is just making a decision as to what is racial bias. So, for example, sometimes it's a lack of awareness from maybe the professional you're dealing with. For example, a case I had, again, referring back to my son, there was a point after he had the chemotherapy where he had to put on sunscreen in order to leave the building, leave the hospital, just for some fresh air. This is after being in isolation for quite a while. And as soon as he put the sunscreen on, because the chemo has already darkened the skin, he went purple, because that's what it did to his complexion. So not only and this was obviously not just him, other kids, because he was 11 when it happened, so there was other children his age. So not only had he not been outside for ages and was just venturing out, he now was self-conscious about being purple. And so when this was months later, I spoke to his consultant about it. He was like happy to be made aware of this is what's happening, because he was not aware of the fact that some black people have an issue with sunscreens turning their skin a purple color. So he was happy to change it. Do you see my point? Yeah. Whereas, another parent complained and said, look, it's because they don't know us, they don't know about black skin and whatnot. But when I approached him later and spoke to him, it was just he was unaware, and he was happy to make that change, prescribe the children another sunscreen, which doesn't give it that purple hue. And so that's one less thing they have to worry about when they're going out.
I completely understand where you're coming from with it. I feel like it's a subtle way of dealing with it. You've kind of used your voice, and fortunately for you, you've seen results. I can't say it's the same for everyone else.
No, of course not. Yeah.
But what would you say, Claudine?
I guess I would I think that's a really good point. I guess we're sometimes trained or we're taught to kind of outsource our health and put it in other people's hands, but actually your body, what your skin should look like, how you should feel. So if you're seeing a professional and something just doesn't feel right in terms of the advice they're giving you, or you take a medication and it's just not working for you, then actually talking about it and having a discussion, but also kind of being ourselves as individuals, being informed about if we're dealing with a particular health condition, trying to find information about it for ourselves as well, so that if the consultant doctor is coming from a place where they're not as informed, you can have a two-way conversation, as opposed to it being them telling you, actually just having it, that you're both human beings at the end of the day, and yes, that person's got a qualification, but you've got a qualification in what feels right to your body, so make it a two-way dialogue. I would say that, and just be an advocate for yourself. Sometimes you might get a lot of no's in terms of tests or scans and things like that, and it costs money for the NHS. But again, if you feel like it's something that you really want, then see how much you can push it to get that test or get that scan, just go that step further to get the information that you need.
Thank you. And being a healthcare professional, in your line of work especially, what are some of the biggest challenges when it comes to in particular black health? What are some of the major challenges that you face?
In working with people, or that they face coming to me?
No, you as an individual, you as a professional working with an individual or a member of the public, a client.
Good question. I guess, I think someone being ready to do the work, to make the changes. So it is like Fisoya said earlier, it's all about the kind of behaviour changes, those small kind of step changes, and coming out of their comfort zone in terms of what they used to eating, what they used to doing, how they used to move in their body, and just challenging sometimes what people think they're capable of, or what they think they can do, or how they're meant to live, challenging that a little bit and just getting them out of their comfort zone. I think that's one of the main things.
It's not really a lovely question, but what are the health issues that Black people need to be mostly aware about? What are the most common ones, or what are the ones that we don't know about that we actually need to know more about in order to kind of protect our health?
I think one thing with Black people, we as a culture, we have traditional ways of cooking and eating and things like that. So sometimes we're just on autopilot of what we eat. You know, your mum used to cook it, now you cook it for your child. And just being more aware of probably what's in your food. And I think just having that awareness, and because it's so hard if you're so used to a tradition and a culture. It's automatic, and all your family gathering is the same thing. You know, like, don't get me wrong, I'm vegan, but I do, cook macaroni cheese, but I'm aware of how often I've cooked it for my son, or, I'm just being aware of nutrition in your diet, I think, is a big thing.
I think so too.
Yeah, we was having a conversation earlier about, our generation being so self-conscious about healthy eating and eating the right type of nutrition. But I feel as well, I think it's our duty, even though we're a self-conscious generation, to educate our elders. As much as it's hard and, you don't want to come across as disrespectful, but I feel like as a duty, if we're doing something that is benefiting us, I feel like it's our duty to educate, the other generation, and be like, look, it doesn't have to, doesn't have to be cooked like this. It doesn't have to be, we was having these conversations earlier, and it's quite interesting just to hear, because, you wanna okay what it is you're trying to say, but you don't want to come across as disrespectful, especially being an African culture, and I feel like as our duty, if we're doing something that is making us better, we need to be vocating that to an older generation, and so they can live long as well, because we want to see our parents live to a certain age. So I feel like as we're educating ourselves, we should be educating also the older generation.
But do you think our traditional and religious beliefs have an impact on our ability to seek help? Do you know what I mean? Like, in terms of how you've been brought up, if you're from a certain demographic or diaspora, you're being, I guess, as you said, you're following a narrative that have sort of been passed down from generation to generation. There's not been much change. So I don't know, do you think our traditional or religious beliefs prevent us from seeking help?
100%. I mean, if you're in a household where majority of the people that you live with don't seek any help, you're more likely to do the same. I think it just comes down to, again, having that conversation and educating ourselves. The stigma as well attached with seeking help is, you're seen as crazy, or and all that kind of jazz. But I feel like because it's becoming a common conversation that we're having with regards to mental health, I think it's a case where we just need to keep having these discussions and making people more comfortable around the idea of seeking, counselling or seeking therapy. Doesn't mean that just because you're going to see a therapist, you're going to get sectioned, Yeah, and it's just that, that mentality that we have, especially as Black people, we need to break that stigma and be like, it's fine. Sometimes you can't have a conversation that you really want to have with like a family member. You feel more open to speaking to someone who's more of a professional, like a therapist. So I think it's, again, just having those engaging conversations, but making sure it's in a setting where it's comfortable and the other person can understand from where you're coming from. So yeah.
Amazing.
Yeah, I do believe the traditional beliefs has an impact on our health. And I think in regards to mental health, I think definitely that affects us, and us feeling that seeking help is maybe a weakness, and you just need to get over it, whatever it is. But also it would be good to raise awareness for the fact that checking on your mental health needs to become like a normal thing. It shouldn't be have those attachments and those connotations.
Like it's taboo to speak about it.
Because there's so many different levels when it comes to mental health. It doesn't have to be the extreme, what someone might call it the crazy guy on the street. It could be just you have sort of blue moments or depressed moments, and just I think we just need to be more aware that there's ways to deal with it. You don't have to just live in this bubble. This is me. There's ways to cope. There's ways to deal with it. There's things you can put in place if you seek the right support and help. And I think, just making that more the norm, so other family members are not, looking at you sort of sideways, thinking, you've gone to visit, a therapist. There must be something wrong. It's actually being proactive, actually, to make that visit, so you can then take more control over your over your mental health and over your life, essentially.
I love that narrative. I love it.
Yeah, I'd agree. Basically, I think that some of the cultural ways and the religious belief can be a blocker to us seeking help and feeling comfortable about admitting that we're dealing with issues. And I think there's that narrative around the strong Black woman as well, that we just get on with it, you just push through, and it's actually damaging mentally, emotionally, physically. I think we just need to change that, and it's not about being strong, it's actually about being vulnerable and talking and saying that I have my weak moments and sometimes I need help,
Food for thought, isn't it, that one? I'd definitely say that information is key and information is power. So where do we get our health information from? Like, which mass medium or which outlet do you go to seek is it the NHS? Is it the BBC? Is it Google? Like, where do you actually go to get health information? Because it seems to be scaring a lot of people wherever their sources are. That's why there's a lack of movement towards, this is what's wrong with me. I need help. Let me just go sort it out. But I guess it's not that black and white, is it?
I guess, you need to make sure that the sources you're looking at are credible, number one. And, within what I do, there are certain organisations that are trying to, it's not anything that's been put in place legally, but are trying to kind of monitor the quality of information that influencers are putting out. So you might have someone who's selling like diet pills or herbal teas or something like that to lose weight, compared to someone who has actually got a qualification and is putting out scientifically based health or nutrition information. So there's a difference between the two, and I think it can be hard for the normal person to kind of understand or see that difference, but just trying to make sure if you are looking at influencers or if you are looking online that the information is coming from someone that is got a qualification or is registered with professional organisations. And also people can look at, although they could be hard to interpret, but there are scientific papers, so particularly PubMed, which people can Google. You'll get a scientific paper and it will have at the beginning just an abstract of what the study is about and what the results were. So people can kind of look at that. Like I said, you can find studies for stuff and against stuff, so you need to use your discernment with it as well. But Google and things like that, I wouldn't say are your friend, but trusted outlets, I would say are, or even going on like particular doctors. Like America has quite a few doctors, like Dr. Mark Hyman and other people who put out quality information, and they've actually got a qualification. You can look at it and, go by that. So, yeah.
I love that.
I think as well, if you only find what you seek, so if you're looking for that key kind of help or support, I think it's really, really, like you said, doing your research thoroughly and making sure you're getting the right type of support instead of just generally just looking on the internet and trying to find something that could just give you that quick fix. So I think it comes down to just doing your research properly.
Okay, and before we wrap up, I just want to ask one more question. What do you think it's going to take to eradicate these stigmas in the Black community? You know what I mean? And stigmas, it's a bit, especially when it comes to mental health, as you said, it's quite taboo. It's like the dirty little secret everyone brushes underneath the carpet. But what do you think it's going to take for us to eradicate stigma? I genuinely feel like it's about sparking a conversation because it starts within a household. I would love to hear your views on it, though.
I'd agree. I think it's talking about it, and I think even from my own experience, like talking to friends and family members, I think before I started doing what I'm doing, mental health or emotional health or anything like that, I never ever spoke about that with anybody, or people weren't talking to me about it. But now I guess because I have conversations about it with people, I find that people in my friends and family circle come to me more and a bit more open and vulnerable about what they're going through. So I think just having conversations, and even if no one around you is having those conversations, maybe leading by example and starting a conversation, I think is helpful. Yeah.
Thank you.
Again, just more awareness, more conversation, which will hopefully normalize situations and not have them as a stigma, because it's more openly discussed. Yeah, that's about that's what I think will help to eradicate. And also speaking up. If you do have an incident where you feel you've been a victim of racial bias or anything like that, share it, speak to someone about it, so that, dissect it, to make sure that, yes, it is what you think it is, So I think, yeah.
Also, just looking at the common problem and just stop looking at it from maybe as a stigma and just seeing it as just a general problem that everyone has, we all bleed the same. So I think it's really key that there's just more support for Black people in general, so they can have someone they can identify with, but more or less that support is there where they can openly go there and seek the right support that they need. So just having more support, especially for Black people.
Thank you. I've thoroughly enjoyed this conversation, guys, but sadly we've come to the end of the show and we're going to wrap it up. So before we wrap it up, I just want to get your final top 3 tips on, for the listeners and the viewers, on Black health and well-being and how we can change or navigate or better off ourselves. We need the top tips, guys. So Claudie, what are your 3?
I would say if and where you can, working with a professional or tapping into a professional's resources. We put things out there in terms of newsletters or free downloadable tools and things like that. So like I said, either working with a professional or using their resources. And particularly if you want somebody that looks like you and that can identify with what you're going through, I guess just looking for those professionals. So if it's mental health, you can look on the if I remember the name correctly, but the British Association for Psychotherapy or something like that, and you can look at the profiles and actually choose a therapist, a Black therapist if you wanted to, or I think it's a Black Therapist Network. Again, like for people like me, nutritionists, you can go on something like BANT or Nutritionist Resource. You've got all the profiles there, and you could choose a particular nutritionist who you identify with. So I would say working with a professional, tapping into community resources as well. So we're talking about mental health, and there's a organisation I think that started just this year called Black Minds Matter, focused on therapy for Black people. So I think they're doing amazing work. And I think final one, I would say, just seeing how you can, talking a lot about stress and mental health, seeing how you can manage stress. And some of the things I tell people is, stress is about you having a higher load than what you can deal with. So whether you can release some of that load, or whether you can delegate some of it, or whether you can outsource some of it, but looking at the load that you've got on your plate and what you can do to manage it, basically.
Oh my God, amazing. Thank you for those tips.
What I would say, so definitely I would say almost like a problem shared is a problem halved. So join other communities or join communities that are going through similar situations to yourself. So for example, if you have a child or you're caring for someone with a certain condition, join Facebook groups and things like that, just to hear other people's opinions and ideas and share experiences. Also, I would say seek support. Don't be afraid to seek support. Seek support and accept support. Sometimes, again, we feel we can do it all by ourselves, but if there's support out there, take it and don't feel like you have to bear this all alone. And the final thing which I found in regards to my own situation was there's so much negative things surrounding people that are going through stuff. So maybe try and have a can-do approach to things. So say there's so much, again, it's from experience where something will go wrong or someone have a crisis. I'll be like, oh, you can't go to school. So much can't. Then we switched it around. We're like, right, what you can do is we can read together, or we can, go for a walk after an hour or so, So just adopting a can-do attitude, I think is to take you quite far.
Thank you.
3 tips I would say is don't be afraid to seek any help. Be open to the idea of receiving help.
Absolutely.
Yeah, like you said, don't feel like you're going alone with it, and just having those conversations with someone that you feel safe with. And I think that will ignite you trying to get the right support and lead you on the right path, God willing. The second thing I would say is, I think, do what makes you happy. I feel like it's very important to really, especially during this time that we're in, to really seek out what makes you happy. What can you do? What are the little steps that you can be doing that's going to make you fulfilled in life? Because everyone has their different kind of things that makes them happy. So just trying to find out what makes you happy and how that could be useful and beneficial to you. And the third thing I would say is, make sure you do your research when you're looking for that right support system. I think it's very key. There are Black therapists out there, but it may not be public on social media, because that's not the best outlet to go to when you're seeking help, but making sure you're getting around the right set of people who may be in the same vicinity as you and looking to get the same type of support. So yeah.
Oh, thank you, Fisayo. Oh God, so many tips. Which ones am I going to take away? No, just kidding. So my top 3 tips would be, so number 1 would be to spark a conversation. Number 2 would be to raise awareness. And number 3 would be to change the narrative, you know? Can you tell us where you're at, where our viewers and our listeners can find you?
Yeah, so you can find me on Instagram. It's at Claudine J Thornhill Nutrition. Website is claudinethornhill.com. So yeah, drop me a line.
Well, if you have any questions for me, you can find me on Instagram at Alicene. So it's at Alicene Official. So I'll spell it at and then ALICENE Official. And look out for the blog coming soon, which will be Sickle Cell Anemia Conception to Cure.
Oh wow, well, sounds like some amazing stuff. I'll definitely keep an eye out. And Fisayo, where can you find you?
You can find me at Fisayo FYO. If you want to discuss any of the topics that we've spoken about today, and feel free if you want to open a conversation. I'm at Fisayo FYO.
Thank you. Well, sadly, guys, that's it. We've come to the end of the show. Thank you to all my amazing guests and to you guys at home for watching. Join me next time and we'll be talking more about being Black in Britain. I hope you've enjoyed this episode of Ask the Panel. Don't forget to like, comment, share and subscribe.